Crowded conditions share bathrooms and common areas and are virtually unable to be socially distanced. Prisons and jails are a hotbed for the spread of COVID-19.
These become incubators of disease. It's in all of our interest to try and stop the spread within the prison walls.
Dr. Eric Toner is the co-author of a report on vaccine allocation published by the Johns Hopkins Center for Health Security.
We put together this group to think this through, starting with very basic ethical principles that everybody would probably agree to, such as do the most good for the greatest number, treat everybody fairly.
For months after coronavirus ramped up in the U.S., he and several other health security experts worked to establish tiers for vaccine allocation once it's available.
Phase 1A would be healthcare workers that they define very broadly. It's essentially all healthcare workers and residents of nursing homes.
Toner and others recommended that prisoners or detainees be in Tier 2. His reason?
One of the basic tenets of public health is to stop outbreaks at their source. And in many communities, community outbreaks are coming out of the prisons.
Here in Hampton Roads, nearly every jail has experienced a large coronavirus outbreak. Just last week here at the Chesapeake Correctional Center, 232 inmates out of 1,000 living behind these walls tested positive. That outbreak prompted the sheriff to open an isolated COVID-19 unit. While some may disagree to give prisoners the vaccine, Dr. Toner says we have a legal and ethical obligation to safeguard the health of those incarcerated.
That's not part of their sentence. Their sentence was to be in prison. It wasn't to be deprived of health care. We vaccinate prisoners. We give them flu shots. We give them other essential health care.
This week, Governor Northam stated Virginia is expected to get 70,000 vaccines from Pfizer in the first wave. The CDC recommends those go first to healthcare workers and the elderly. I'm Chelsea Donovan for News 3.